Hello everyone, I am Dr. Yasir Rizvi. I am working as a senior consultant in nephrology at Dharamshila Narayana Super Speciality Hospital, Delhi. Today I shall be discussing about kidney transplants. First we need to understand what is kidney transplant. Kidney transplant is a procedure where a healthy kidney is retrieved from a living person and transplanted into a patient who has chronic kidney disease. So the new transplanted kidney takes over the function immediately, and the patients of chronic kidney disease can be taken off dialysis. Broadly, there are two types of donors. One is the living donor, where the kidney is retrieved from a healthy living person. The other type is a deceased donor transplant, where a patient who has developed brain death, which may be seen in patients who have had a road traffic accident, and the family consents for donating the organ. The kidneys can be retrieved from such patients and transplanted into a patient who is on dialysis, and this is called as a deceased donor transplant. What are the benefits of kidney transplant? So a patient who is having advanced renal failure, apart from medicines, they need dialysis, dietary restrictions, and they are on a number of medications and injections. After a successful kidney transplant, the new kidney takes over the function of the old kidneys, and as a result, patients can stop dialysis. Their fluid and dietary restrictions are removed, and the number of medications are also reduced, and this helps in leading a near normal quality of life. Now, who can be a living donor? So as per the transplant laws in India, any near relative like father, mother, brother, sister, spouse, or children, anyone who is above 18 years of age or less than 60 years of age, they can give their kidneys to a patient who has CKD. If anyone apart from near relative wants to donate, then it has to go to a government appointed committee, and if they give permission, then the transplant can be conducted by the hospital. So there are certain tests which a donor has to undergo before they can be accepted for kidney donation. So any donor who would like to donate his kidney, they first have to undergo a full test like a CBC, kidney function test, liver function test, urine examination, heart test, lung test, so that we have to make sure that the donor is not having any medical issue, so that after kidney donation, the donor should not have any problem. Only once all the tests are okay and we have received all the clearances, that a patient can be taken up for kidney donation. And what are the precautions that need to be taken by a kidney transplant patient? So once a kidney transplant has been done, the transplanted kidney starts functioning immediately and it starts making urine, so that generally we don't need any further dialysis if the transplant has happened successfully. But patients who have undergone a kidney transplant, they are on medications called as immunosuppression. So they are generally on 3 immunosuppression, and the function of these immunosuppressive drugs is to bring down the immunity level so that the new kidney is not rejected. So as a result of these medications, these patients are prone to certain infections like pneumonia, diarrhea, urinary tract infections. So they need to be careful about the diet that they are taking, and they should not go out in areas where there is an increased risk of infections. It is also important to note that patients who have undergone kidney transplants, they are started on these immunosuppressive drugs, which are generally continued lifelong, because this transplanted kidney is recognized as an outside organ by your body, and the body immune system, it tries to destroy it. So this is called as rejection. So this is another thing that needs to be followed up regularly, and this is done by a nephrologist by doing your regular blood and urine tests. So what are the contraindications for transplant? So there are certain patients like those who have active infection, or those who have active cancer, or they are on chemotherapy, or if they have advanced liver, lung or heart disease, so that they are at a very high risk of complication during surgeries. These patients are not suitable for kidney transplant. So whenever a patient who has end-stage renal disease and is on dialysis, they first have to be assessed by their nephrologist to see whether they are suitable for kidney transplant.